All right, so we're here today to talk about the head and neck and what would you be doing right now if you were feeling 100%. Okay, so in terms of rehab, when you come to Lift Clinic, the first thing that you're going to do when you have some head and neck pain, you're going to come in and we're going to ask you a whole bunch of questions. We're going to try to take a kind of a full body point of view. So we're going to look at not only how your head and neck are moving, but how all the adjacent regions are moving, and getting right down even as far as the feet. Now, it's not super common that we will find stuff in the feet that's directly driving your neck pain, but it does happen. And so basically with all of our assessments at Lift, we're always going to do kind of a bit of a head to toe screen for understanding if there's anything that really stands out that might make us want to actually investigate that a little bit further. But then as we're kind of getting through all of those things, we're going to be getting into that more specific regional assessment and looking at kind of key movements like forward bend, back bend, rotation. And each of those movements themselves has its own breakout that we're able to kind of figure out what's specifically limiting that movement. So if you're not able to touch your chin to your chest, is it because there's a limitation in mobility in your upper neck, or is it because there's a limitation in mobility in your mid to lower neck, or is it a limitation in mobility in your upper back or even your sternum and the inability to kind of allow that motion to take place? So we need to be able to figure out those kind of mobility limitations as well as strength and movement control. And that's just one example of how we're going to kind of start to break out some of those movement patterns or look at each one of those step by step. So how do different disciplines treat head and neck pain? So here at Lift, we've got physio, chiro, massage therapy, and strength coaches. And each of us, even within our own disciplines, has our own unique level of abilities and skills. It's our job to kind of understand one another and where we can make a good handoff to each other so that somebody else's skill set could come into the treatment plan for a client. Classically, with massage therapy, we expect that we're going to be getting treatment focused on muscles and maybe the fascial system. Physio, we're going to be looking at similarly treating muscles, fascial system, but also that neuromuscular aspect a little bit more with movement control and exercise, and a little bit of maybe some joint mobilization or those kind of things. And then with chiropractic, we classically kind of think of these are the experts on joint mobility techniques. And have kind of the greatest depth and scope of training fundamentally. But really, once each of these clinicians starts practicing, the clients that they see, their professional interest can take them in different directions. And so it's important that we understand which areas we're able to kind of bring people into and how that can, how my skill set may be best benefited for this particular client by one of our other team members. And so we actually spend a lot of time working together as a team so that we're able to make those really efficient handoffs and work together to maximize the benefit to our client. So a lot of clients will ask us, who should I see first if I have head and neck pain? Sometimes you have a little bit of an intuitive sense, you have a sense that it's just some muscular tension and you're like, maybe I want to go and get started with massage therapy, or it feels really pinchy, this feels like a joint thing, maybe I want to start with chiropractic. Oftentimes we encourage people when it's been more of a chronic thing, or when it's been sometimes have a more of an acute injury situation with a lot of pain, to come to physio or chiro for a really detailed assessment. And then from there, we're going to be able to kind of plan things out and help you figure out who you want to be incorporating in your treatment plan. But in any case, I think it's fair game to come and see any of us. And once you kind of get started, asking that question, within your session, do you think I should be working with any of your other team members here? And just feeling confident that we can help to guide you through that. Okay, so another question is, what are some of the common head and neck injuries that we see? So probably the most common things that people come to us for will be headaches, whiplash injuries from car accidents, as well as just, I was sleeping and I woke up funny and all of a sudden something locked up and I can't really move my head and neck. So those are the ones that tend to come up the most often. And it's really interesting with headaches. Often we can have multiple different muscles that are becoming really tight and grumpy that are actually causing pain referrals into different areas in the head. We're able to kind of figure out which muscles those may be actually by the descriptions that the clients are giving us, and start to kind of target those muscles, but then often looking deeper to why are those muscles becoming so irritable. So this is where that regional and kind of head to toe assessment comes in. Is it because you can't rotate your trunk or extend through your upper back that it's putting a lot of pressure onto these muscles because your shoulder blade actually isn't moving normally in relation to your rib cage? So these are examples of where that really detailed assessment will help us to get to the bottom of things, in addition to treating the symptoms in that muscle specifically. The example of like, oh, I just woke up with a lot of pain and I can't really move my head and neck, so a muscle spasm, maybe something got a little agitated and then something, the nervous system just started to kind of build tension until finally it sort of locked up on you a little bit. This is pretty common too. Having some intervention, often with chiropractic and physio. Often IMS is really fantastic for that. That combination of IMS and chiropractic can be really great. Sometimes, again, we'll advise you if we feel like getting in for massage therapy may be beneficial at that point in time as well. With our whiplash, our motor vehicle accidents, everyone's a little bit different. Everybody's situation and what they brought to that situation in the first place is a little bit different. So a lot of times clients are like, hey, how long is it going to take for me to get better here? And it's hard to answer that question immediately. So coming in, getting that assessment early on and getting going with your treatment sooner rather than later can be really important. And again, even though you had that mechanism of injury, we need to look at what's underlying for the body and start to kind of fix all the little moving parts so that everything works nicely together. Yeah, so this question, how does optimal head and neck function help you to run, jump, train, play, and lift? Really, this is such an important area. We have two different kind of key areas here. One is like the upper neck, where we need to have like full range of motion to be able to retract or kind of nod. We want to see about 20 degrees range of motion, and it's super common. People will come in with like chronic neck tension or shoulder pain, and they have a limitation in that upper neck flexion. We also see often a limitation in upper neck rotation. These areas, because there are so many kind of big long muscles that attach from the head and upper neck and down onto the shoulder blades and that area, when they're kind of tight, and when we have a limitation up top, when they're tight, we'll have those muscles kind of putting a lot of pressure on the middle area of the neck, which is where all the nerves come from that go into your arms. And so we'll see things like weakness or limitation in range of motion out in the shoulder because of that upper neck mobility limitation. At the same time, if you don't have any of that upper neck mobility limitation, but in the mid C-spine you do have some limitation, the same thing can happen. So we need to have that area functioning optimally so that the nerves that come out of there and go into your arm are going to be happy, all right? And if they're not, we'll see commonly limitations in internal rotation or that reach up in behind the back. And oftentimes we'll see like really consistent tension that can underlie things like tennis elbow or just chronic rotator cuff pains, stuff like that. In terms of optimizing performance with our neck area, it relates most to the arm, right? And so this is where it's like explosive throwing movements, explosive hitting movements with sports like volleyball, things like swimming and having a really nice fluid reach. Things where, it depends really if we're looking at sports, gymnastics, we need to be able to accept and create explosive forces through our shoulders and feel stable. So there's just a really wide range. It depends on what you're doing with these areas, and that can kind of tell us like what our functional needs are. But if we're not too healthy through here, we're just giving up on range of motion and we're giving up on control through the shoulders, and so it really does affect your performance. So again, now thinking about our head and neck area, whether the goal is performance, whether the goal is rehabilitation, the key thing for us is it all starts with assessment, right? So coming in sooner than later, let's just get a look at what's going on, and let's start to get you a plan for how you want to start moving things forward as quickly as possible.